This is Sanjay and Jane. Like everyone at EMAS, they're on a journey. Back in 2015, the road was bumpy, but we've turned a corner since then. We've improved clinical outcomes and focused on better value, so we could invest in new ambulances and the electronic patient report form system. But we're not out of the woods yet. There's a growing demand for health services. We need to be able to access the right care for our patients' needs, which means changing how we work. What else lies ahead for the EMAS team? Jane and Sanjay want to do their bit and help patients access the right care. Hospital isn't always the solution, but it's difficult to know what services are available in different areas, especially out of hours, which is frustrating. The good news is NHS services are changing and the patient journey will improve. Sanjay and Jane are offered advanced training and continuous professional development opportunities. The EOC team has received improvement training too. Now Jeff and Steph are better equipped to send out the right response vehicles first time. This means less wasted journeys, which will support our staff by allowing them to get their meal breaks and finish on time. What's next for our EMAS teams? On their journey of improvement, Sanjay and Jane's station is merging with the local fire and police services. At first, they were concerned, but by working together at EMAS, we're benefiting from the change. The money saved on restoring old EMAS stations has contributed to better buildings and improved shared facilities. It's also been used to fund new ambulances, equipment like the electronic patient report form system, and more frontline staff. Not only do Jane and Sanjay enjoy being linked with colleagues from the other emergency services, the general public seem to like it too. What else is changing for Sanjay, Jane and their EMAS colleagues? For Jane and Sanjay, patient care is the most important thing, and they're keen to improve this where they can. This means being able to treat patients on scene, as well as ensuring that they receive further treatment from the right service. New technology is helping. Filling in the electronic patient report forms correctly is important. In an emergency, the hospital receives information before the patient arrives. It also gives clinicians access to the patient's current and previous medical data. The data recorded is used to plan, agree and monitor health services in the East Midlands. And in cases which are not an emergency, it means that Sanjay and Jane can refer the patient to the service that they really need. Jane and Jeff are very happy today because they're on their way to a patient reunion. Jane remembers back to when she received the EOC call about a sudden home birth. They rushed to the scene, but there was no time to get Mum to hospital. Instead, they helped with the safe delivery of baby Francis. 1 year on, and Mum and Dad want the chance to thank the EMAS team and to reintroduce them to the baby they delivered. It's a happy ending, but the journey isn't over yet for Sanjay, Jane, Jeff and Steph. They know that if the whole EMAS team work together, things can improve for everyone. That means everyone who works for EMAS and all the people we care for. Do your bit, get involved and make things happen.